pregnant women around the country faced uncertainty upon the arrival of COVID-19. The medical community identified significant knowledge gaps in the impact of the virus on mothers' and babies' health at all stages of pregnancy. Knowing more about the impact of the virus on pregnancy and the safety of the COVID-19 vaccines for pregnant women is vital for treatment and prevention. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hitterly with AHA Communications. In this podcast, Dr. Rachel Humphrey, Director of AdventHealth for Women's Maternal-Fetal Medicine, joins Kathy Cummings, Director of Communications at AHA, to talk about the safety and effectiveness of COVID-19 vaccines for both mom and baby, critical role physicians play in addressing COVID-19 vaccine hesitancy, and how doctor-patient relationships are strengthening during this pandemic.
Dr. Humphrey, thank you for joining me today for this important discussion on COVID-19 vaccines and pregnancy. In a recent op-ed published by Becker's Hospital Review, you talked about the unfamiliar role you found yourself in when placing young, previously healthy women on life support and having to perform preterm C-sections in an attempt to save their babies' lives during this pandemic. Tell us about that.
Yes, it is an honor to take care of pregnant ladies. I've been doing it for 2 decades, and I have to say that for many, many years of my time working with pregnant women that were sick, it's been very rare to infrequent that we've had women that were on life support, and even more rare to have to make the difficult decision to deliver a baby severely preterm to save the life of the mother. Unfortunately, for me and many of my colleagues across the country, what was something that we never dreamed that we would be doing or had scarcely ever done before became relatively commonplace with the COVID-19 infection spreading across the United States, particularly the surge that we had in the Delta variant in 2021.
Certainly, these have been unprecedented times. I can't imagine what it's been like for women who are pregnant or breastfeeding. Being pregnant or trying to conceive, during this pandemic brings a whole host of new worries for expectant mothers. How do you open up the dialogue with your patients about COVID-19's risks and the benefits of getting vaccinated?
Well, I have long found that anxiety in pregnancy and concern for the baby are some of the strongest motivating emotions that my pregnant patients have. And oftentimes, the worry about getting vaccinated by a pregnant woman or by her family is related to concern that there may be a risk to the pregnancy or to the baby. And so I'm able to utilize that emotion and give data which has clearly demonstrated that not being vaccinated is actually a greater risk to mom's health, and that not being vaccinated during pregnancy poses a greater chance for a serious COVID-19 infection in her infant. By educating patients and using their natural instincts to do what's best for the baby, I've been able to have good success in getting women to accept vaccination in pregnancy.
Brings to mind the important role that physicians play in our lives, right? And the value of developing relationships, not just contact, but relationships with patients. So, talk to me a little bit about your relationship with your patient during this pandemic and what you've learned from it moving forward.
Sure. Thank you so much, Kathy, for that insightful question. So, my relationship is partly determined by my role. My field is of being a perinatologist or maternal fetal medicine specialist. So, I see pregnant moms that have been referred to my practice by their regular obstetric provider because there's fear of complications in the pregnancy or known complications in the pregnancy. And so my relationship has always been a very strong one with my patients. because they're coming to me with so many fears and so many anxieties. They've been told that their pregnancy is quote unquote high risk, which means that they're more risk for problems than the regular pregnant mom. And that actually is something that really pulled me into the field because I really enjoy talking to people and teaching. And I find that having an empathetic approach and giving people real knowledge and data can be the best way to provide reassurance.
And when we talk about reassurance, one of the things that we're looking closely at now is advising, encouraging patients to get that COVID-19 vaccine. And what has been your approach to that?
Well, my approach actually depends on the patient's preset assumptions. For example, quite a few pregnant women now have actually had a COVID 19 infection. So, for my patients with a previous COVID 19 infection, I have a different way of counseling them than if they had not. Many of my patients were vaccinated and still got sick with the Omicron variant. If they've completed their vaccine series and their booster and also had the Omicron variant, I let them know that they've done a great job with vaccination. They've actually had the infection. If they were not severely ill or hospitalized, I give them reassuring information about what to expect for the rest of the pregnancy. Based on a history of a mild COVID infection with full recovery in a vaccinated patient, I don't recommend any additional treatments or alterations to their general obstetric care. I have a completely different discussion for my patients who have had COVID 19 in pregnancy and are unvaccinated. Many of those patients are under the false assumption that having COVID 19 infection in pregnancy confers a significant protection to their babies against COVID 19 and gives them a significant protection against COVID 19 in the future. And we know that isn't true. The immunity obtained from a natural COVID 19 infection is transient, lasting only several weeks, so that you can get infected again. And I personally have taken care of pregnant women who have been hospitalized with COVID 19 infection more than once a month or greater apart in their pregnancy. Not only that, but we know from science and from studies that the immunity that the babies achieve from a natural infection that the mom gets during the pregnancy is inferior to the immunity the baby would achieve from mom getting vaccinated during the pregnancy. And so for my moms that have had an infection and are unvaccinated, I encourage them 10 days or greater after their infection, essentially when their quarantine period is done, to go ahead and get vaccinated. And our preference is that they get vaccinated with the messenger RNA vaccines, that is the Pfizer or the Moderna vaccine in pregnancy. Lastly, I have a group of patients who have never had a COVID 19 infection that they know of, but they're unvaccinated. And I encourage all of these women, I tell them that the single best decision that they can make for the health of their pregnancy and for the health of their baby as a newborn is to get either the Moderna or Pfizer vaccination series in pregnancy. We know that's going to decrease mom's chance for complications that might occur with a COVID infection, like high blood pressure, blood clots, C-section, preterm delivery, and even stillbirth. And we know that getting that vaccination series in pregnancy is going to decrease the chance that her infant could get sick with COVID 19 in the first few months of life.
So we know the science is there. And I'm wondering, are your patients responsive to the science? Or are there some patients where you have to maybe go a little bit deeper than that, maybe a little bit more of a personal approach to convince them?
So I have patients that I can appeal to on a personal level, just as a physician with expertise, talking about their concerns and fears, answering their questions, and that's enough to give them the information that typically will result in them choosing to get vaccinated. I also have some patients that are extremely hesitant to discuss vaccination and pregnancy. For them, it may have reached to almost a political level in their lives, and they feel that it's not a physician's role to give that information. in those cases, I actually almost pull away from the emotional component and actually will say, well, I like to give this information because it's medical. I give it to all of my patients. And then I third party it essentially and say, some of my patients are very interested in vaccination because of X, Y, and Z. And some of my patients are fearful of vaccination because they, for example, think the vaccine gets to the baby or think that the vaccine can cause miscarriage or infertility. And then I go into the data that shows that COVID-19 vaccination does not cause infertility, does not cause miscarriage, does not cause problems in the pregnancy.
Well, and we know there is still hesitation out there, right? So does it become an ongoing conversation, or are there new creative things you're trying, methods that you're trying to still reach those that are unvaccinated?
Yes, so about half of pregnant women in the United States are not vaccinated. And it is something that I find discussing vaccines. Patients were much more interested in hearing about vaccines during the Delta variant. And we started the Delta variant with only about 30% of women vaccinated. And there was quite a rapid uptake as data about the stillbirth rate and the very sick pregnancy rate and moms dying from COVID-19 news reports that came out. Then there was sort of a lull briefly after that. And then there was quite a bit of interest in my pregnant ladies when Omicron came out. Right now, we're dealing with a lull, and it is difficult to engage patients in discussions about vaccination right now. I am finding that to be true. And I try to explain to patients that right now we are dealing with a new B2 variant that may become significant and is more contagious than Omicron. But even more importantly, we don't know what variants are out there. And we don't know if those variants that develop may be something that's more serious for certain populations, pregnant populations. We know Delta was worse than Omicron, and even more concerning, worse for infant populations. So I try to bring up to patients that while right now it doesn't seem pressing or important, people like to believe that this is maybe the end of COVID-19, that truthfully, this is an infection that is now endemic. It's not going away. And we need to be very concerned about keeping moms safe, but also babies and newborns who are particularly susceptible to any infection as safe as possible.
And as the pandemic evolves and the possibility of new variants, what do you think is the state of misinformation? Do you have a lot of patients that are coming to you who are misinformed?
Yes, I would say actually at least a third of my patients have misinformation about vaccination for COVID-19 and pregnancy.
How are you encouraging them to use accurate resources of information?
Well, actually, I tend to serve as one big resource and I will answer whatever questions that come up. One of the most common comments that I will hear of misinformation is that they are not willing to get the vaccine because they think it is new or experimental. And so I'm able to give them information of how we have used messenger RNA vaccines even almost a decade ago for Ebola. So this is not a new technology and it is not considered experimental. So I will address whatever misinformation directly. And then I do like to refer patients to the V-Safe Pregnancy Registry, which is great information about being pregnant and vaccination that is very reliable.
So those are all good resources. What are some of the biggest lessons learned during these past 2 years?
Well, for me, I've been most impressed in how quickly we've been able to get good information out in the scientific literature. It had been, pretty much all of my life as a physician that it would be 2 years to see a study idea come to fruition and come to results. And the amazing receptiveness of the scientific community to redirect, to get good information out for clinicians like myself and for my patients, it's just been awe inspiring and something that I'm going to carry with me even after this. And the other is that I was so willing, and all my partners were so willing to do whatever it took when we first learned about this epidemic, and we are located in Florida, and seeing what was going on in places like New York and saying, hey, we'll volunteer, we'll cover what we need to cover to make sure that patients are safe. And that was something that I saw throughout my institution here at AdventHealth. And that was something that I think I'm going to carry with me too, as just such a heartwarming thing to think about.
Yeah, I mean that does, lead me to my next question in terms of how has this pandemic changed you as a physician, changed the way that you relate to your patients or change your practice in any way?
Well, for me, it's been a great practice on a regular basis to be willing to discuss something that patients may not be as willing to discuss. It's actually hard as a human being to bring up a topic that someone may not really want to hear about. And when I was taking care of patients pre-COVID, there really wasn't a daily topic that I had for each patient to bring up to ask them a status and then to give them information necessarily about that had as much political charge or divisiveness as the COVID vaccination does. And so it's hard for us physicians. We actually really want patients to like us. We want what are good patient surveys and that. And the truth is, this is a good reminder that while I want to be well liked and have a positive and affirming relationship with patients across the board, that sometimes I have to bring up information they might not want to hear. And the funny thing is, many times I brought up the information that they didn't want to hear about vaccination, completed the talk, and gotten sort of either no response or sort of an eye roll or indication that it didn't matter, they weren't going to get vaccinated. And then they come back a month later and they go, you know what, I thought a little bit more about what you said and I got vaccinated. And so it's just amazing to me that I'm going to take with me as well, is that bringing things up is important. And even though you may not feel that you've hit a nerve or gotten the right information to someone at that moment, later on you did. And so just being willing to continually have the energy to bring it up, even now when patients really don't want to think that COVID is still around.
I love that insight because more and more I'm reading about how the pandemic has, kind of revealed the importance of this patient experience. I mean, we've been talking about patient experience for a long time now, but it's really shed a whole new light on what that means and what we're doing about it to improve that patient experience. You did mention this is not over yet, right? And so wondering what challenges do you see?
Well, for me, there are many things that have been uncovered by COVID-19, the COVID-19 epidemic. And for me, it has brought into very sharp focus inequities in care. And certainly, we know that our pregnant women who are Hispanic, Latino, or Black are much less likely to get vaccinated. They are more likely to get significantly ill. And so that has been something that has definitely informed how we approach patients in my office. We actually never put up educational posters in our office prior to this epidemic. We have large posters in both English and in Spanish now in our waiting room, as well as handouts in multiple languages about COVID-19 in pregnancy and the safety of vaccination in pregnancy. And I think that that is something that I want to keep focus on, because we know these disparities exist and we need to recognize them and address them if we ever hope to improve.
Great, I love that. And I love the idea of the posters because I imagine that those are ways to start that conversation, right? That really enhance the importance of conversation. And then, we're hearing so much too about the ongoing staffing shortages and, thinking about newcomers, young men and women who are thinking about coming into the field of healthcare, coming into the field of maternal health. What would be your advice to them?
I would say absolutely. I feel like that absolutely they should follow their dreams and go into medicine. any field that they're interested in, including maternal and fetal care. I feel that the education that is required helped empower me to keep my family safe and to know what to do during the epidemic. So I feel like my background was very beneficial to all of my family members, from my mother and my siblings, my aunts and uncles, my children. So I feel like that's one huge benefit for having a medical background. If there is, an epidemic coming up, let's say in another, 15, 30 years. And I feel that also, in a sense, interestingly, being in the medical field, I felt a little bit more protected in some senses. Our facility at AdventHealth was amazing in getting both PPE to the staff, the appropriate education to the staff, and also getting vaccinations to the staff. And so that was something that actually made me feel better. I was like, wow, I'm so lucky that I'm a doctor. Yeah, I'm taking care of sick patients with COVID, but in December of 2020, I had also started my vaccination series. So I think there are a lot of benefits to having a medical career in an epidemic. And I don't think that's really been emphasized. I think a lot of people have said, oh, if you're in an epidemic and you're in the medical field, you're going to have to take care of sick people. And I said, well, yeah, but you're also going to be really protected if you're in a good facility, and you're going to be the first in line to get things like vaccinations for obvious reasons. So I think that's actually a huge benefit of going into medicine.
Yeah, you're right. That's wonderful. Any final thoughts?
Yes, I did want to talk just a little bit about some of the common questions that I've gotten from my pregnant women about vaccination. So, one of the most common questions that I've gotten from my pregnant moms, because oftentimes they'll say, oh, I was just waiting to talk to you. If you said it was okay to be vaccinated, I wanted to get vaccinated. Then the next question will come, when to get vaccinated in pregnancy. And we actually have data on this because we have so much data. Over 200,000 American women have been vaccinated in their pregnancy. So we're able to really get some good data from that. And one of the things that we know is that the earliest possible in pregnancy, or just prior to pregnancy, or even a few months prior to pregnancy, if you can get vaccinated then, that's going to give you great protection in the early part of the pregnancy. And when we're talking about vaccinations, of course, we're talking about the Pfizer or the Moderna messenger RNA vaccines. And then the booster is given about 5 months later. And if the mom has gotten the vaccine before pregnancy or in the early part of pregnancy, that booster is usually after 20 weeks gestation. We count pregnancies by weeks. 40 weeks is your due date. 20 weeks is a halfway point. That also equals about 5 months. And we know that moms that get immunized in the second half of pregnancy, they confer more protection and immunity to the baby. I like to remind moms that we've been vaccinating moms in pregnancy preferentially since the 1960s. It was in the 1960s when it was recognized that the flu was worse in pregnant women than in women who weren't pregnant, that women who were pregnant got preferentially given the flu vaccine. And what we know from 50 years of giving the flu vaccine is that vaccination in pregnancy saves infant lives. And so I like to emphasize that while it's important to get vaccinated for the flu in pregnancy to help protect moms from getting sick, it's equally important for the babies, for that protection when they're just a few weeks to a few months old. They're most susceptible to any viral infection, the flu, COVID-19, respiratory syncytial virus, you name it. I also like to remind moms that we've been giving the Tdap vaccine for decades for the same reason. And that's a vaccine that the mom gets in pregnancy that protects the baby from whooping cough. A lot of my pregnant moms get confused. They say, well, wait a minute. You're giving me these vaccines to protect my baby. Those vaccines must go to the baby. So I always like to emphasize, the vaccine stays in your arm. Whether it's COVID, flu, or the Tdap whooping cough vaccine, the vaccine stays in mom's arm. None of it goes in her bloodstream. None of it reaches the baby. None of it even reaches the breast milk. But the mom develops an immunity, an immune response. And that immune response that she develops circulates throughout her body. And that immune response goes to the baby just as her immunity to things she may have had years ago, like chickenpox, also goes to the baby for the first few months of life. And that immunity protects the baby from infection when it's very young and susceptible. That immunity will also pass through the breast milk. I have some pregnant moms who say, you know what, Dr. Humphrey, it's just so new. I don't want to get vaccinated till I've delivered. I like to tell those moms that that's not what we recommend at all, for a couple reasons. One is mom can still get infected during pregnancy if she's waiting till after. And an infection in pregnancy increases her risk for serious complications. Serious complications for her, like a C-section or high blood pressure or a dangerous blood clot, and serious complications for the baby, including stillbirth. Severe preterm delivery as well is seen for these babies. And so I really encourage them not to wait till after they deliver. Also, they'll say to me, oh, I'm waiting till after deliver because I'm going to breastfeed. Well, if you wait till after you deliver and get vaccinated right after you deliver, your body doesn't make a significant antibody response until after your second mRNA vaccine a month later. So there's a long delay in those antibodies getting into the breast milk to actually protect the baby. They're not going to be there to protect her newborn when her newborn's most susceptible. And so I like to emphasize to those moms that are thinking, well, I'll wait till after delivery to reconsider the data that's out there and to get vaccinated during pregnancy.
Well, I like that. I mean, it says that this pandemic is more than just talking about the benefits of a COVID-19 vaccines, that it's really an opportunity to talk about all vaccines and really start to encourage and advocate for vaccines in general.
Yeah, absolutely.
Great advice, great insights here. Dr. Humphrey, I hope we have the chance to talk again later down the road to see how things are going and how your work is progressing. Thank you so much.
It's been my pleasure. Kathy, thank you so much for having me.